The sun was setting over the quiet neighborhood of Maplewood. A warm breeze drifted through the window of a small brick house on Willow Street, where Lucy Harlow sat curled up in her favorite armchair. She was reading an old novel she had borrowed from the local library, something about a hidden treasure and a band of daring explorers. Little did Lucy know, her own hidden mystery was about to unravel. One that would not involve secret maps or buried gold, but rather a silent disruption deep within her body, waiting for its moment to reveal itself. The first clue, a surprising change. Lucy had always considered her menstrual cycle fairly typical, mild cramping, predictable flow. And it usually ended by day 5. But one autumn evening, something changed. Her period began heavier than usual, and the bleeding persisted, stretching well beyond her normal 5 days. By the 10th day, Lucy was alarmed. She found herself feeling drained, often dizzy upon standing, with a constant sensation of fatigue hovering over her like a dark cloud. Maybe it's just stress, she reasoned, considering she had recently taken on a promotion at work. But as the days dragged on and the blood flow did not subside, she knew it wasn't just stress. It was time to seek professional help. Seeking answers, Lucy booked an appointment at the Maplewood Women's Health Clinic, where she met Dr. Abigail Norris, a calm yet sharp obstetrician-gynecologist. Dr. Norris listened intently as Lucy detailed her concerns. Her period had lasted nearly 2 weeks, with moderate to heavy bleeding throughout. She was experiencing significant fatigue, occasionally accompanied by lightheadedness. She also noticed more clots than usual. The differential diagnosis. Dr. Norris began to list possible causes of menorrhagia, i.e., abnormally heavy or prolonged menstrual bleeding, hormonal imbalances, perhaps related to perimenopause, polycystic ovary syndrome, PCOS, or thyroid dysfunction, uterine fibroids, benign tumors in the uterus that often cause heavy bleeding, adenomyosis, endometrial tissue growing into the muscular wall of the uterus, endometrial polyps, small overgrowths of tissue in the uterine lining. Coagulopathies, blood clotting disorders, such as von Willebrand disease, endometrial hyperplasia, a thickening of the uterine lining, which can sometimes be precancerous. Lucy swallowed hard. The list was extensive, and the possibilities daunting. Dr. Norris, in her reassuring tone, explained that they would go step by step to uncover the culprit. Investigation begins. History, physical examination, menstrual history. Dr. Norris gathered detailed information about Lucy's cycles, length, volume, presence of clots, and any related symptoms. General health. Lucy mentioned recent fatigue, lightheadedness, and shortness of breath after mild exertion. Clues that could hint at anemia. Laboratory tests. Complete blood count, CBC to check for anemia. This would measure Lucy's hemoglobin and hematocrit levels. Thyroid function tests, T3, T4, TSH. A thyroid imbalance can cause irregular or heavy menses. Coagulation profile, prothrombin time, PT, activated partial thromboplastin time, APTT, and in specific cases, von Willebrand factor if a bleeding disorder was suspected. Imaging, transvaginal ultrasound, to look for fibroids, polyps, or any structural abnormalities in the uterus and ovaries. Sure enough, Dr. Norris discovered that Lucy's hemoglobin was below normal, confirming that her prolonged bleeding was causing anemia. However, the thyroid panel came back normal. The ultrasound report finally provided a crucial clue: a few small fibroids in the uterine wall and a thickened endometrium. While fibroids were there, they did not appear large enough to alone explain such heavy bleeding. The next step was an endometrial biopsy to check for any abnormal cells in the uterine lining. The mystery deepens. Days later, Dr. Norris called Lucy with the biopsy results, no signs of malignancy or severe hyperplasia. While this was good news, the question remained, why such heavy, prolonged bleeding? Dr. Norris explained that sometimes multiple small factors, like small fibroids, slight hormonal fluctuations, and stress, can combine to tip the balance. However, Lucy's chronic iron deficiency anemia also heightened the severity of her bleeding, creating a vicious cycle. Heavy bleeding caused anemia, which made the bleeding even worse. Diagnosis: menorrhagia with underlying anemia, with major pathologies like cancer and severe hyperplasia ruled out. Dr. Norris concluded that Lucy was dealing with menorrhagia partially driven by her small fibroids, borderline estrogen-progesterone imbalance, and now worsening anemia. Formulating the treatment plan, Dr. Norris laid out a structured management protocol. Iron supplementation: ferrous sulfate 325 mg orally once or twice daily, with vitamin C, like a glass of orange juice, to enhance absorption. Goal: replenish Lucy's iron stores and correct anemia, improving her overall energy and reducing the cycle of heavy bleeding. Medical therapy to control menstrual bleeding: combined oral contraceptive pills, COCPs. Dr. Norris prescribed a low-dose estrogen-progestin combination pill, e.g., ethinyl estradiol 30g, levonorgestrel 150g daily for 21 days, followed by a 7-day placebo interval. These pills help regulate hormones, stabilize the endometrial lining, and reduce blood loss. Alternatively, Dr. Norris mentioned another option if Lucy preferred a non-oral method in the future. A levonorgestrel-releasing intrauterine device, IUD, could help reduce uterine bleeding over time. Tranexamic acid, if needed, if Lucy experienced an exceptionally heavy flow in a given cycle. Dr. Norris advised tranexamic acid 1g orally 3 times daily for up to 5 days during menstruation. This medication helps clot formation in the uterine lining to reduce blood loss. Non-steroidal anti-inflammatory drugs, NSAIDs, for pain and slight additional reduction in bleeding. Lucy could take ibuprofen 400 mg every 6 to 8 hours, with food, during the first few days of her period. Lifestyle recommendations: nutrient-rich diet with adequate protein and leafy greens to support hemoglobin production. Moderate exercise, especially once her iron levels improved. Stress management: practicing yoga or mindfulness to keep hormones balanced. Follow-up: Dr. Norris emphasized the need for regular follow-up. Lucy would return in 3 months for a repeat CBC to assess her hemoglobin levels and iron stores. They would also evaluate how well the oral contraceptives were regulating her cycles. The turning point: Lucy diligently followed Dr. Norris's instructions. The iron supplements made a noticeable difference in her energy levels. Although it took a couple of cycles to see a real change in her menstrual pattern, by the 3rd month, her period was noticeably lighter and lasted only 6 days, far better than the marathon bleeds that had left her pale and exhausted. She felt relief washing over her, and her life started to feel normal again. She could meet friends for coffee without worrying about accidents. She could climb the stairs at work without feeling out of breath. And best of all, she no longer dreaded her monthly cycle as a looming, disruptive event. The finale: resolution. 3 months after her initial diagnosis, Lucy sat in Dr. Norris's office once more, beaming. Her follow-up CBC revealed that her hemoglobin had crept back into normal range. The menorrhagia was under control, and the harrowing days of prolonged bleeding felt like a distant memory. Sometimes, Dr. Norris said, reflecting on Lucy's case, our bodies give us subtle signals that something is amiss. And other times they send up a bright red flag, like the heavy bleeding you experienced. Either way, listening to those signals and seeking help early can make all the difference. Lucy left the clinic feeling like she had solved a personal mystery, an uneasy puzzle that had once seemed terrifyingly unsolvable. It was not just about conquering the heavy bleeding, it was about learning to trust her instincts, seek professional advice, and ultimately reclaim her life with renewed strength. Epilogue, a lesson in awareness. Weeks later, Lucy found herself browsing a bookstore. She spotted a new adventure novel on display and smiled, recalling the parallels between her own health journey and the brave explorers in the story she loved. She had faced unknown perils, gathered clues, and emerged victorious, older, wiser, and healthier than ever before. And she couldn't help but think, there are, indeed, hidden treasures in life, but sometimes they lie in the simple things, like returning to a normal, healthy rhythm and discovering the power of self-care along the way.